Hello, Samira. Welcome, and thank you so much for joining me today to take time out of your busyness to share a little bit about your career and your life as a BCBA. And so I just wanted to first thank you, and then also introduce myself a little bit. We already know each other to a certain extent, but I will open up the stage for you to share a little bit more about yourself. So previously, when I was living in California, you were my supervisor at Cadient. Now I am currently pursuing a Master's of Science in Psychology with emphasis of applied behavior analysis. Mentors like yourself invested into me and helped during my growth process, and I'm still growing, and thankfully I get to continue sharing it with you a little bit. I made the decision to pursue a credential or certification in BCBA under the board certified BACB. And so this has been a growing passion, but I am totally on board now, and things are rolling and things are happening. And so I just wanted to take this time for you to share a little bit about your wisdom and your insights within the field. And so to start, I'd like to ask a few questions for you. And so the first one, I'm very, very interested. You did clinical psychology in Pakistan before you came to the United States for 2 years. And I have some research finding that I found. It's by an article called Cultural Appreciation of the Modified Checklist for Autism for Screening Autism in Ghana, which was in 2021. However, it was very relevant because it brought up some studies showing that there are different behaviors that we witness in different countries. So depending on where we are in the world, we can be exposed to autism and those behaviors being shown differently from place to place. And so I would like to hear a little bit about your experience as a clinical psychologist when you did your work in Pakistan.
Thank you so much, Jonathan, for having me, and congratulations for starting your master's program, and a very best of luck to you. You brought up a really nice topic here, and it's like cultural differences in autism manifestation and diagnosis. When I was back in Pakistan, I was not working as a BCBA, I was a clinical psychologist. So the tools people were using there for diagnostic purposes, those tools were created, and all the research on those tools were from other countries. And we were just using those tools and we would apply that to our population. And certainly as a clinician, I felt that there are differences in terms of exposure and learning histories of people there versus people where those tools were created. So there was a gap in terms of applying that set of, you can say, information, diagnostic tools or diagnostic information to a different country where the learning histories are different, exposure is different. So certainly there were some tweaks needed to use those tools where those were not researched, and like those were created on a different set of population, having different learning histories and different experiences and different exposure, I must say.
What made you switch from a clinical psychologist to a BCBA? What built up the passion for a BCBA?
I would say I found behavior analysis a very practical and very measurable approach, you can say, and very quantitative. Like, it's data driven. We collect data ongoing, and it's more like in vivo experience or application of the treatment versus clinical psychology. Not to say that clinical psychology is not closer to my heart. It is. I've spent like good 8 years there, but I found even when I was practicing clinical psychology, clinical behavior analysis was really close to my heart. So I think it's more practical, it's more data driven, and we help our clients as in their natural situation. So it's just helping them on an ongoing basis where the actual problem lies.
Right. Also, share one highlight your journey to United States. What is one highlight coming from Pakistan into the United States towards the BCBA?
I'll try to pick the most critical one.
Okay.
I think behavior analysis here in USA was certainly more structured approach than back in Pakistan.
Mm-hmm.
So that was one thing that I really learned here. Secondly, BACB is more organized and developed here versus developing countries. So I can just give you an example that we didn't have any testing site back in Pakistan for BCBA exam, and we have multiples here. So that was one main difference.
Okay. Awesome. And then when I knew you in California, so you were specifically working with children with autism for a company called Cadient, and now you're working with adults for a company called Meraki.
Yes.
Between the two age categories, what does a typical day look like for you as a BCBA? And what is one of the most significant impacts or results that came about your treatment with a client?
When I was working with kids and as adolescents in center-based and home-based settings, my day would be more lenient as compared to when I'm working in an EBSH setting. So EBSH is Enhanced Behavior Support Homes. Right now, currently, I'm working in those settings where certainly the needs are more. Now I'm serving adults. So it's longer histories of reinforcement and like longer trauma histories. So certainly the need is more intense here versus in home and center-based services. But I've totally enjoyed working in both settings equally, and I've learned a lot working in both settings. And then you asked my like how the treatment was impactful in both settings, and I feel like generally in ABA the treatment is impactful because we devise a treatment based on the function of the behavior or the reason why something is happening. And when we combine that function driven approach with trauma based or trauma informed care, then we get to see impacts, like we empathetically learn about our consumers or about our clients, like why they're engaged in whatever they're engaged. So when we figure out that why and we combine that with knowledge of their trauma history, and we start providing trauma-informed care to those consumers, and we empower them by giving them effective tools to manifest those needs. I think that's impactful in ABA.
Awesome. And so myself as a psychology learner, I'm kind of excited and passionate about this topic because you were the first one who really brought it up to me, and that's the topic of critical thinking. And so I wanted to ask you, what do you do for yourself when you feel like the frustration is too high and your head's going to explode? You know, what do you do for yourself when you want to throw in the towel?
There is certainly times when we don't feel the best of ourselves, and working in healthcare and specifically working in ABA could be stressful sometimes. So I feel like it's really important to recognize and self-monitor to just pick up on those signs of frustration and burnout, you can say, because ethically our ethical code, BCBA ethical code, it also says that self-monitor and take a break when you feel that your treatment is not going to be as effective as it should be. So to me, I feel like self-monitoring is really important. So I would just be open and ask for a break. I'll step out, step back for a moment to reevaluate things and reevaluate my own emotions before manifesting those emotions. So just little self-care moments, taking breaks, and just nourishing our own selves is really important. And that's what I do, just to create a balance between my personal life and my professional life.
Yeah, I remember at Cadient, we had some very high profile behavior cases. Have you ever felt like there was a case that was just too much, that it's beyond the boundaries or borders of actual therapy work?
I would say yes. There's been some times I'm fortunate enough that I've got chance to work in intense behavior settings and some high need cases. I feel like yes, there are some times when I felt that the needs are beyond my expertise, and those are the times where one should openly seek out for help to remain ethical, because our ethical code, as given by BACB, says that if something is beyond your expertise, then one should seek clinical supervision from somebody who is trained on that problem, or who is trained in that domain. So yes, there's been some times where I felt that my previous training was not at par with the current needs, and I've certainly reached out to people who are more trained in that domain, or they had more expertise in that area. And I worked under supervision. Even as a BCBA, I worked under supervision of another BCBA who had more training in that specific area than me.
And also, so I'm aware BACB has their ethical codes of conduct, for example, and it's very accessible online. Are there any resources that you would advise as far as guidelines for how to handle high volume stress or situations of that nature when going towards BAs or BCBA?
Sure. So I would say sign up with BACB newsletter and like keep yourself update for whatever is happening new on the website, just to make sure that we are in a line of our ethical code and all the guidelines. That's one thing. Just keeping in touch with the research is really important. Sometimes when we get into practice and we are not actively a student, then it's easy to lose that bond with research. So I would say just like subscription from some journals, or just like looking for some recent researches based on your areas of interests and your areas of experience is really important. Keeping up with the research is really important. And there are some, sorry to cut you off, there are some like amazing groups where you can join and you can get additional support in terms of managing your stress and like getting additional support in clinical experiences. So yeah, I think joining those groups and just like bonding with other professionals or having relationships with professional relationships with them is really important, so that you can seek out help whenever you feel that you're stressed out and you just need an additional support from a professional.
No, absolutely. That's excellent advice. Thank you. So the next set of questions, it's focused on behavior analysis as a field. So many companies I've observed have their own culture. Some allow money to control them, while others do not and do the right thing. One of my greatest passions for any company is simply doing what is right. What is some advice you would may offer concerning ethical awareness, values to look for in a company, or things to observe within a company as it pertains to behavior analysis?
Very nice question again. I would say that it's really important to just apply those behavior principles or performance management principles in a company, and encouraging ethical practices and reinforcing those ethical practices within a company and building that culture, and just building the culture aligning with the company's values is really important. So just keeping things like monitor employees' behavior ongoing, like whatever you want to see more of, set contingencies and reinforce that, monitor, provide objective feedback. Nothing is subjective, like everything is objective. Right. And we are measuring things ongoing, and providing feedback and providing support by modeling is the key component in clinical practices. And just I've seen many companies, they have like ethical hotline, or they would give their employees an ethical like email where they can post, or they can ask any ethical questions that may arise down the road during their clinical practices. So I think though all of those resources within a company are really important to encourage that open communication around ethical questions one may have, and promoting ethical practices. So and then just bridging everything with BACB's code of conduct is really important.
Right. No, I'm amazed at the power of applied behavior analysis, because even though I'm still an RBT, registered behavior technician, I noticed ABA can work with the employees that we work with. It can work with our spouses. It can work in church settings. It can work, across the board, anywhere where there's behaviors. So I really appreciate your response to that.
Yes, I would say it's ABA is growing. Like wherever there is a human behavior, there is ABA.
Right.
So I've seen people working in NASA, behavior analysts working in NASA, in forensics, in environmental sustainability departments, in motor vehicle departments. So wherever there is human behavior, there is ABA, and this field is growing. And I feel like if it's effectively implemented and applied, people can do wonders.
Right. What values would you say are identifiable within the company that you work for?
So it's important for me personally to align my values as a BCBA and a company's values, and I think it gets easier for a BCBA to work in an environment where these two values align and they go hand in hand. For me personally, in my current practice, I would say empathetic treatment, like trauma-informed care, is really important for me, and it aligns with my values, like my values as a clinician and the company's value. And the other thing is like effective treatment.
Mm-hmm.
So everything should be research-based, and treatment is research-based there. So that's one thing I'm working with them.
Cool. And then as a behavior analyst, I will encounter cultures that won't always come as familiar. What do you advise for cultural competencies to assure that I may provide effective treatments for my clients?
Yes. Since we are providing services to people with a variety of learning histories and a variety of exposures, so it's really important for us to be culturally informed when we are serving someone whose culture is a little different than mine. So as a clinician, just to be informed and just to stay open with my client and their families is really important, and to the best extent possible remaining within those ethical guidelines, I would tweak my treatment so that it can set well with their cultural preferences.
Mm-hmm.
So that's the first thing. Whenever we are serving any family or any client, that's the first thing we should keep in mind, to be culturally sensitive towards them, and tweak our treatment plan based on their cultural needs.
Right. Yeah, I was reading some things actually just yesterday, where it was saying how there's a lot of psychologists, they struggle in that area to tweak specifically when they're in assessments, when there's cultural components that they have to adjust to. And so I can only imagine how complex it can get, especially in a culture that might be radically different than your own.
Absolutely right. In psychology, or in applied behavior analysis, when we use tools like norm-based assessments or criterion referenced assessments, then it gets a little tricky because we can tweak those to only a certain extent. We cannot tweak assessments like norm-based assessments to a culture drastically. So it can get very challenging, especially when we are conducting those assessments. It gives a little bit more room to be culturally sensitive when you're conducting functional behavior assessments, though. And that's my personal experience or my personal insight around assessments, that there is less room to tweak when we are conducting norm-based or criterion-based or any like any tools, any tools for assessment, versus when we are just conducting FBAs or functional assessments.
Right. Yeah, even my research study question, so I had to kind of like play with it because I was bringing too many components into one question. And so I narrowed it down to how do individuals respond to adolescent with ASD from a third world country context. And so I was finding a lot of things, not just people of that culture, but psychologists working in that culture, also responding to all these culture variables, as well as clients, parents, and other people who know the client responding to ASD. And so you have all these things going back and forth.
Yeah.
Not just of that culture, but of the psychologists as well.
That's right. I remember when I would like to share this experience, like when I was back in Pakistan, we would come across with some tools assessing some domains, like let's say social support or psychological well-being and all that stuff, but the original tool would be in a different language than native's language. So language barrier, like language difference, is the first thing that come across. And even the translation process is it's a process, like it's a strategic process that one should follow to translate one tool to another language. So, and when people translate, it can sometimes give a totally different meaning than it was giving in the actual language it was created in. So yeah, it starts with language difference, and then context difference. Then learning histories are different. Exposure is different. So there's a lot of stuff to think about.
Right. Yeah, definitely. I think it just built my excitement also at the same time, because as little research that is done in this area, especially when you get into the third world countries and outside of the Western European context, I think regardless of the limitation of study, I think to a degree I'm engaged cross-culturally, but there's so much to learn, and there's endless opportunities to learn more. And so I'm excited about that. We're coming towards the end of the interview, and for someone who is pursuing BAC or BCBA, what is some advice? You know, there's supervision hours, there's preparing for the exam for BCBA, all these things, tracking your hours. What are some little tips that you can leave me as well as anybody else who may be watching this video?
Sure. I would say just stay informed as a candidate with the website and the requirements. Recently there's been some changes for RBT supervision requirements and people who are working towards their BCBA and BCABA certifications. So just stay informed with those changes, track your hours proactively, and just work together with your supervisor to keep things ethical and to keep things aligned with BACB's requirements and your practice, like wherever you're accruing those hours, their values. So it's really important to, at the end of the day, keep track of everything and keep yourself informed with BACB's guidelines and requirements.
Right.
And just connecting with people who work in the same area of interest helps a lot to gain like effective and appropriate experience that aligns with your interest in practices.
Awesome. Well, you answered all my questions with excellent information and insights on it. This does conclude our interview for today. So I just want to thank you so much. It's been a pleasure and an honor, even just to know you, but to know you on this this level as I'm going towards BCBA. And I'm sure we'll have more opportunities. Is there anybody else within the field that you can suggest that I maybe contact them in regards to information about the field?
Sure, there are a bunch of people I can ask them and I can give their information to them, and certainly connecting with different professionals is the key to build your support network in your profession. So I would be happy to relay their information to you, and connecting with people on LinkedIn has been really helpful for me. Yeah.
Cool. So thank you so much, and I will be in contact with you, and I will let you know how your video benefited some other professionals as well going towards their BCBA.
Always a pleasure. Thank you so much for having me.
Thank you so much.
Bye.
Bye.